Cleveland and Detroit, Rust Belt towns that have a lot in common.
Both were once manufacturing powerhouses and both have since reinvented themselves. But despite the similarities, they could not be any further apart when it comes to COVID-19.
Detroit's Wayne County has more than twice as many coronavirus deaths as the entire state of Ohio. News 5's Jordan Vandenberg explains Governor DeWine's reasons why.
Days feel like weeks, and weeks feel like months. During the COVID-19 pandemic, the time and the date seem almost irrelevant. But in the days before the pandemic began, every single second counted.
Compared to other states, our health director and our governor intervened aggressively earlier in the epidemiologic curve.
Dr. Keith Armitage is an infectious disease specialist for University Hospital's Roe Green Center for Travel Medicine. He lauded the work of Governor Mike DeWine and Health Director Dr. Amy Acton, crediting their quick decision-making for a smaller pandemic curve than anticipated.
They've gotten a lot of criticism. People protest their press conferences, but just look at Detroit. Just look at some of the cities in the greater New York area. Look at New Orleans. And we are so fortunate that they acted when they did.
Cleveland and Detroit make for a startling comparison, Dr. Armitage says. As of Thursday morning, Detroit's Wayne County had more than 12,000 coronavirus cases and nearly 900 deaths. In Cuyahoga County, there have been nearly 1,300 cases and 39 deaths. Despite having only 30% more people, Wayne County has had more than 20 times the number of COVID-19 deaths as Cuyahoga County. All the while, Cuyahoga County has been preparing for, while hoping to avoid, a surge.
Cleveland's blessed with, I think, 3 great hospitals. UH, the Cleveland Clinic Metro, 3 institutions were preparing for massive surges, all sorts of planning, and we're ready. I don't want to jinx this, but it looks like if we keep it up, and even with a little bit of loosening, we can hopefully avoid that big surge that would be extraordinary.
The comparison between Detroit and Cleveland is not without variables, however. Detroit's airport has more international travel. Michigan has an international border. In the state's primaries were held in early March, while Ohio's were postponed. That being said, Governor DeWine has slightly outpaced his Michigan counterpart, being one of the first governors in the nation to impose stay-at-home orders and close restaurant dining rooms.
People understand the message around social distancing. We've seen evidence of it. And that's very heartening to see that people have adopted the Ohio plan.
Not having a sense of complacency is key. And based upon their performance so far, the governor and health director, I think, will continue to send the right message.
Dr. Armitage believes a safe partial opening could be possible, assuming the progress continues. And for many across Ohio, they'll be counting down the days for that to come. In Cleveland, Jordan Vandenberg, News 5.